Hi friends, I'm Dr. Priya from Smile Zone Dental Speciality Center, and today I'm going to talk to you about one of the most common questions that patients ask me in my clinic, which is how to replace missing teeth. And this is a big concern because if there are multiple missing teeth, then it also affects facial appearance, your confidence, not just your physical health because it affects your eating, but also your emotional health. So it's very important to replace missing teeth. And today in this informative discussion, I'm going to tell you about what are the various ways that you can replace these missing teeth. So let's start. So broadly speaking, a patient has three options available to replace a missing tooth or multiple missing teeth. The first being a removable partial denture. So the second is a fixed bridge and the third is an implant. Now I'm going to show you and discuss with you each of these ways. The first way here, which I'm going to show you, is a removable partial denture. This is what a removable partial denture will look like. So a removable partial denture basically takes the support of your palate. It fixes somewhere over here and replaces your missing tooth. However, the problem with removable dentures is being removable, there's always a little bit of food or liquid that you eat that will go inside, and that's uncomfortable for many patients. On top of it, it is a removable component, so many young patients especially would not prefer this option. So the second option available to us is a fixed bridge. Now let me show you what a fixed bridge is and how the fixed bridge works. So this is what a fixed bridge will look like. Right now, of course, there are many materials available for the fixed bridge, but let me explain to you the concept of a fixed bridge. I'll just show you here how a fixed bridge will work. So let's see this picture to see how a fixed bridge is working. Now in a fixed bridge, the place where we get support, unlike in removable denture, is not your palate but these teeth, your adjacent teeth. So these teeth have been shaped and a bridge is placed on top to replace your missing teeth. If I show you on a model, let's say there is a missing tooth here. So how this is replaced is a tooth in front of it and the tooth at the back. Both have to be cut in order to take support for your bridge, and this is how it will fit. These teeth have been cut and that's your bridge. Now, what are the advantages of this? The advantages, of course, it is fixed in the mouth, so there is no hassle of a removable component and the tooth has been replaced very well, and it restores all function. But let's discuss a little bit of a disadvantage here. Now, the disadvantage being that your adjacent teeth have been cut. And most of the times they may be pretty healthy teeth with no caries or no requirement for a root canal. However, if we need to give a fixed bridge, we need to cut these teeth or shape them in order to get support for your bridge. So that is one huge drawback of the bridge. And the second one being that under the bridge where you have a missing tooth, there is always bone loss. So whenever we have missing teeth, there is always bone loss that happens. So a fixed bridge cannot prevent that, and it does not stimulate your bone as an implant does. Now we'll discuss one of the best options that are available nowadays to all patients, and that is an implant. I will be showing you a model of an implant here. This is what an implant looks like. Now let's discuss in brief what exactly an implant is. I will be showing you something here. Now the first question is, what is an implant? Basically, an implant is either a screw or a post-like thing that goes inside your bone. It is surgically placed in your jaw. Now it is completely biocompatible because it's made of titanium and that's a very lightweight material. And what the implant does is it replaces your missing tooth's root. On top of the implant, we use the implant to give a single crown, a fixed bridge, or a removable denture or a fixed denture. So an implant basically provides support for all these prostheses, right? So let's see how an implant is placed. This is how it looks like. So the implant goes inside the bone and on top of it your tooth is restored. Now the huge advantage is nothing else is touched. No other teeth are affected when we do the implant. It's surgically placed in the bone just like a tooth removal with minimal discomfort. Probably when an implant is done, all you would require would be a mild painkiller like a Crocin or a Combiflam for a day or so. And after that, the implant is restored, which may be either immediate depending upon the case, or it may be after 2 to 3 months, and that's when a new tooth is given. It completely restores function and is one of the best options available to you to replace your teeth. So today we have discussed all the 3 options: a removable partial denture, or a fixed bridge, or an implant that is nowadays available to patients to restore their missing teeth. Thank you for watching.